Welcome to the Physician Associate Podcast.
Hello and welcome to the Physician Associate Podcast. My name is James, and today we're going on a deep dive on physician associates who work in psychiatry. I'm joined by 5 lovely guests for this episode, some doctors, some PAs, for a roundtable discussion about physician associates in psychiatry in general, and I'll let them introduce themselves.
Hi, James. My name's Helen Krimlisk. I'm a consultant psychiatrist working in Sheffield, and I've been working with the Royal College of Psychiatrists over the last couple of years on the Physician Associate in Mental Health project.
Hi, my name's Lizzie Shaw. I'm a junior clinical fellow in psychiatry, currently working with the Emotional Wellbeing Service.
Hi, my name's Twala, and I'm a PA working on an acute male inpatient ward.
Hi, I'm Carolyn. I'm the PA working on the female acute inpatient ward.
Hi, I'm Pranav Mahajan. I'm an SPR in Sheffield and I'm leadership fellow in Physician Associates in Psychiatry.
Thanks, guys. Okay, if we start with you, Helen, do you want to tell us more about your involvement with physician associates?
Yes, James. So I'm based in Sheffield at the moment, and I've been involved in undergraduate teaching at the University of Sheffield for a number of years now, initially with medical students, but a few years ago we heard about the physician associates training in the University of Sheffield and Sheffield Hallam University, who both needed placements in mental health settings. So we provided these, and as we got to know these students a bit better, realised what an enormous advantage it would be if we could employ them within our mental health services. And so that set up a project around employing physician associates in mental health. That has been done before elsewhere in the country, particularly in Birmingham and in Merseycare, where early adopters. We now have 10 physician associates working with us in our mental health teams in Sheffield. The Royal College of Psychiatrists has been enormously supportive of this initiative. I've recognised the enormous value that physician associates will have in our mental health settings. And I've been working with the team at the college to work out some structures and some support for physician associates who are interested in working in mental health, and also for employers and trusts who want to think about how best to undertake this.
What was it that initially attracted you to employing physician associates? What are the benefits as you see them with PAs?
We have enormous challenges in mental health settings. We have inadequate funding, and we have inadequate numbers of well-trained workforce. And that's not only in psychiatry and medicine, but also across the other professions as well. Most trusts in the country are struggling with recruitment of nurses, doctors, and other professionals. The time it takes to train a psychiatrist, a consultant psychiatrist, is a large number of years, 12 or so years as a minimum. And similarly, nurses take a long time to train up as well. So even if we could increase the recruitment, and indeed this is happening, there are more places being offered at medical school, it's going to take a long time before we actually have those people in place as fully trained professionals. The Physician Associate Programme is an innovative programme which takes people who are interested in working within our healthcare settings and trains them up to work alongside doctors. They've all undertaken a 3-year undergraduate degree in a science-related or health-related area, and they're then put through a 2-year concentrated master's level programme by the Physician Associate schools, where they learn a whole range of clinical skills in all sorts of different areas. And when they come out of that, they can be employed as physician associates, but they maintain those generic health skills throughout their professional career. So unlike doctors, they don't become super specialised in an early way, but they can move around the system. So this is quite an innovative way of training and quite alien to many of us as doctors and nurses who've trained in a very different way. But I recognise that they could be of enormous value to us, and there are increasing numbers of them now being trained across the country looking for work. And what we've heard through the work that we've been doing through the Royal College of Psychiatrists is that many of them are keen on using their medical skills to work within mental health settings. And that's what we're trying to promote.
Fantastic. Thank you. Thanks, Helen. That's really interesting to hear your thoughts on it. Where have you put your physician associates and what work are they doing within your organisation?
So in Sheffield, we have most of our physician associates on our inpatient settings, and the rationale for that was that that's where we had our greatest workforce need. And that's where we've got our sickest patients as well, many of whom will have significant additional physical healthcare problems and not have access to primary care because they are mostly detained under the Mental Health Act in our inpatient wards. We've got 10 PAs in Sheffield at the moment. I think 7 of them are on inpatient wards, and the others are in our learning disability community services and in some of our recovery services, where we look after some of the more unwell patients in a community setting. In other parts of the country, they've experimented in different ways. So in Birmingham, there's several physician associates working in forensic services. In Merseycare, they've got a number working in their community services alongside primary mental health care services. And there are some also working in CAMS, eating disorders, and liaison psychiatry as well. The opportunities for physician associates to work in mental health settings is enormous, and there's no reason that they can't work in a wide range of services. It is part of their requirement that they are supervised by a doctor, and therefore it is important that they work in conjunction with a doctor, either a general practitioner or a psychiatrist, depending on the setting. There's no stipulation about what level of doctor that needs to be, but in practice, I think that needs to be either a consultant or an experienced specialty doctor.
Absolutely, which leads me on to my next sort of question around what you had to put in place in terms of supervision, CPD opportunities, appraisal processes.
I'll take the question on supervision and appraisal, but I'm going to leave the training one for Pranav because that's his area of expertise. So physician associates are not currently regulated as a profession, but that process is very much underway, and they will then be regulated by the General Medical Council, the GMC. They already are required to have an annual appraisal, and that is an appraisal which will look very familiar to that many doctors are familiar with, where we look at the CPD that they've done, their reflections on this, any incidents or complaints, evidence of quality improvement activity or audit. So familiar type of appraisal. They require supervision, but not in the same way that a trainee in psychiatrist needs supervision. And indeed, although they need to be supervised by a doctor, much of their experience will come from their work within the multidisciplinary team. Of course, when they start in your service, they're going to need a lot more help because if they come straight from PA school, they will actually have very little clinical experience. As they become more experienced and have been in the team for longer, the need for that supervision is likely to diminish. And that's an ongoing discussion between the supervisor and the PA as to what they can do. There is a managed voluntary register for physician associates, which is held by the Royal College of Physicians, which hosts the Faculty for Physician Associates. And it's our strong advice that any physician associate who's employed is required to be part of that managed voluntary register, because that will provide assurance to the trust and the supervising doctor as to the level of CPD that they're having and that they're meeting the requirements which are likely to be necessary as soon as they become regulated next year.
Thanks so much, Helen. That's really interesting. If I bring in Pranav at this point, can you let me know what your involvement has been in supporting your PAs in psychiatry?
Yeah, I actually sort of became involved with PAs through Helen. When I first started at the Trust as a higher trainee, I had an interest in medical education. So I emailed Helen, who was the medical education lead at the time. And she said, actually, we've got these 4 new PAs starting in a couple of months, and I want you to develop a teaching program for them. So we were starting, very much with the basics, and the aim of the training program that I developed was to help physician associates integrate into a psychiatry MDT. I wanted them to be able to learn the language of psychiatry, because I'm sure, as you know, every specialty has its own language. It has its own acronyms. It has its own sort of ways of doing things, presenting things. So I wanted to make sure that they were fully clued up on that so that they could have the best possible experience within their MDTs. We did that using case-based discussions, using sort of live seminars, face-to-face teaching, tutorials, simulation teaching, and then, reflection groups as well, to try and help our new recruits to sort of think more deeply about our patients and what might be going on for them.
What have you put together? What have you found that they needed What gaps have they got, and how have you been addressing them?
I think initially our thought was, can we integrate them into the teaching sessions that we already offer our core trainee doctors? But what I found was that actually I think they needed the foundations or the building blocks putting in place beforehand. We developed a 2-year program, and in the first year we offered initially very sort of straightforward teaching sessions on common mental health presentations, their management, the investigations and the diagnosis. We would then have case-based discussions around that. Physician associates would bring cases to discuss, with the idea that in the second year, the physician associates would then be able to join the core trainee teaching, because those building blocks or those foundations are now in place. And like I was saying before, they understand the language, integrate into that teaching a lot better. Carolyn and Twalia are also on the line, and they've been through the 2-year sort of program that we set up, and they might have a better insight for you as to how that was for them.
Yes, I found the first year sort of the interceptorship year where the Trust offered different teaching and the simulation that Pranav spoke about really helpful. And then going into the second year onto the core trainee teaching, obviously we come in with like a 3 weeks experience of mental health, so not having that grounding knowledge was really helpful with the way teaching was set up.
Yeah, I agree with Carolyn. I found the interceptorship really, really good. We started off with the little sessions each week, and that helped to develop things like my history taking for like depression, how to assess for risk. I found that really useful when I first started, because the teaching at university isn't like, you don't learn that much at uni, you learn more on your placement, which was, as Carolyn said, only 3 weeks. So I found that extremely useful, just to get me settled in. And then the core trainee teaching as well that we attended, I found that absolutely brilliant. Because even some of the doctors that I met on the training are now working on the same ward. So it's always nice to have that rapport, that friendly face. And the doctors get to know a bit about our role and what we can do and our limitations. So it's quite useful.
Yeah, fantastic. Pranav, is that something you would recommend other trusts looking at doing something similar? If you could do it again, knowing what you know now, would you change anything?
Well, I mean, the world has changed since we developed this. When I was doing it with Twalia and Carolyn, it was face-to-face and quite regular. I think now it's being done mainly online. It makes things a little bit more difficult with regards to simulation sessions and things like that. But I would 100% recommend that a trust that is interested in bringing PAs into mental health sets up something similar. Obviously, each trust will have to evaluate exactly what they want to set up, but some sort of supportive educational program to help PAs make that adjustment or bridge the gap between their sort of postgraduate degree and working in mental health. We evaluated our program, and I spoke to a number of our PAs about it, and of course they were all very positive with regards to their feedback. But what they were also saying is that it had additional benefits, beyond training or teaching. It sort of provided that peer support or peer group, because the PAs are often working in different wards, and in mental health that often means different sites or different buildings. So having that forum to come together each week or each fortnight and meet each other means that they can share ideas, share concerns, just get to know one another, really. It's also been a really good forum for PAs to raise any concerns that they have had, because it's inevitable that when you're trying to integrate a new sort of job role into a pre-existing MDT, that there can be teething issues or problems.
And if I bring your colleague in, Dr. Lizzie Shaw, do you want to tell a little bit about your experience of working with physician associates so far from a doctor's perspective?
One thing importantly I've noticed is the the continuity of care that we get with physician associates, in that the ones I've worked with haven't so much been part of the medical rotas. So we find with junior doctors, we're often not on the ward, we're on call, or we're moving around every 4 to 6 months. Whereas having a physician associate on the ward has meant that you get someone there on a more permanent basis, and you do get a better continuity of care for the patients.
And that must make things like the doctor changeover days easier as the new doctors start.
Yes, yeah, that's absolutely right. I think one of the most difficult times being a junior doctor is the changeover day, when you're thrown into a completely new ward that you're not familiar with, sometimes in a completely new hospital. Often a lot of the team is new to the place. So therefore, having someone who knows the ropes a little bit and who can advise the new members of the team on how to go about things, that can be really, really helpful.
And I suppose as the physician associates don't rotate and they are there permanently and continuously, they must see patients who present time and again, and they must know what patients look like when they're healthy and when they're ill and what works for them.
Yes, that's right. I think they get a really good experience, and the beauty of them being in one place permanently is they get really experience within that specialty. They build up a really good knowledge of the particular area that they're based in.
Do you think that improves patient safety?
I think it definitely could do, in terms of them being familiar with the common presentations within that particular specialty. So I think it is really helpful.
Are there any downsides that you've experienced? I'm wondering around perhaps competition for training opportunities, or feeling like you're being pushed out?
It's not something that I've personally come across, to be honest. So I've always felt that we've all had equal opportunities in terms of learning and education opportunities. I've never really felt that there's been any competition between the medical team and physician associates. Not really. I'm struggling, to be honest, to think of any downsides.
Oh, that's good.
Yeah. I'm thinking back to specifically when I worked on a medical ward, and initially we didn't have any physician associates on the ward, and we were really understaffed, very, very busy and under a lot of pressure. We often didn't really get the chance to meet our educational needs. A few months down the line, we did have a physician associate who came and started with us, and we did, I think all members of the team noticed a big improvement, not only obviously in staffing, but the additional support meant that we as medics were more able to attend to our own educational needs, attend teaching.
Well, that's good. And I know a lot of my PA colleagues are quite interested in education themselves. I wonder if in the future doctors might be taught by experienced PAs in their specialties, and that will widen the access to teaching events as well. Perhaps if I put this question on Helen, where would you point people to go to find out more information about physician associates in psychiatry, and if they want to get in contact?
Thanks, James. Yes. So if you're a physician associate who is working in mental health or is interested in working in mental health, then I'd suggest that you get in contact with the Royal College of Psychiatry. In fact, if you Google Royal College of Psychiatry Physician Associates, you'll find a whole section there for people who are interested in working in this area. You can also follow us on Twitter, RC Psych Physician Associates. If you're part of a mental health trust who's interested in employing physician associates in these roles, again, there are some excellent resources available on the Royal College of Psychiatrists website. So that's where I'd guide you to going.
Thanks, everybody, for talking to me on the podcast today. I hope it's been really useful for the listeners to find out a bit more about physician associates in psychiatry. If you've got an interesting idea for an episode of the Physician Associate podcast, please get in touch with me. I'd love to hear about you and get you on the show to find out more about what's going on with physician associates up and down the country. We're on social media at PA Podcast UK, and I hope you'll join me again for the next episode.
Thanks for listening to the Physician Associate Podcast.